the first time was exciting. This was the first time that I was going to meet my extended family, my beautiful aunts, uncles, cousins, nieces, and nephews. On the plane ride, I was so excited to tell them everything about my life, from school to hobbies and more. I just wanted a connection with them. But what was excitement turned into utter realization when I met them and I couldn't understand what they were saying. Imagine the sheer thrill of seeing family only to be met with the harsh reality of a language barrier. Shame struck through my body as the lack of knowing the rich Punjabi culture ushered in broken connections. There was no way in which I could connect with my family, and that left me disconnected and isolated. Now, a language barrier refers to the challenges in communication that arise when individuals cannot communicate effectively due to a lack of common language. Now, these barriers can emerge from cultural diversities, communication ambiguity, and simply differences in languages. For instance, in the United States, 25.1 million individuals are limited English proficient, in which their ability to read, write, and understand English is impacted, highlighting the pervasive nature of language barriers in various aspects of our lives. In addition, globalization, cultural shifts, and socioeconomic factors also contribute to the decline of linguistic diversity across the globe. For instance, today, 61% of languages around the world that were first spoken in 1795 are extinct. Moreover, it is estimated that at least 50% of languages that are currently spoken today are endangered, further emphasizing the ongoing threat to linguistic diversity, highlighting the potential disappearances of numerous languages within the 21st century. Now, language barriers aren't just confined to personal experiences. They extend into critical areas of our lives, especially in aspects of healthcare. And within the healthcare industry, language barriers can have major effects. For example, 14% or 46 million people have difficulty in the ability to find, use, and understand information and services to make health-related decisions for themselves and for others. And within the United States alone, more than 350 languages are spoken across households. And with 350 languages spoken across households, it is reported that up to a quarter of all interpretations are incorrectly translated, meaning that legal and ethical implications may occur over time. Now, studies have found that among patients who do not speak the local language, nearly 35% experience confusion about how to use their own medication. Additionally, 16% have suffered a bad reaction due to the inability to not understand proper usage, meaning that people who experience language barriers are subject to longer workups, longer emergency stays, more hospital admissions, and more medical charges. Now, due to these constrictions, more than 65% of people who do not speak the local language experience a language barrier, including 20% who did not even seek out healthcare due to fear of misunderstanding healthcare providers. Now, poor training in healthcare can exacerbate the problem, further limiting access to quality care. If our own doctors cannot understand the language we speak, how do we expect them to treat us at all? Now, addressing language barriers in medicine is a crucial step in ensuring effective healthcare for all. Doing this will not only enhance patient safety, but will also create an inclusive healthcare system for all. We can do this through translation tools, diversity training, and more. Access to clear and concise healthcare information is a basic right for everyone, regardless of what language they speak. By prioritizing linguistic diversity in healthcare, we can promote better patient outcomes, enhance the quality of care they receive, and ultimately contribute to a more equitable healthcare system for all. Now, by reducing language barriers, health and financial disparities can also be reduced. This is a significant step in reducing poverty in migrant and limited English proficient communities as they can receive care from a healthcare system that was made to serve them, not harm them. Everyone should have the right to basic and quality healthcare without facing discrimination based on race, gender, or status. Having a healthcare system that focuses on equal rights and addressing health disparities fosters an environment where patients are treated with dignity and respect. Achieving equal rights in healthcare not only promotes social justice, but also contributes to an equitable society where everyone has the opportunity to lead a more healthy and fulfilling life. Now, language barriers aren't just confined to healthcare, but can also pose challenges in personal relationships, hindering effective communication and stronger relationships as well. Breaking down barriers is crucial for fostering meaningful communications and building strong, diverse communities as well. Embracing open-mindedness, cultural sensitivity, and effective communication skills strengthens personal relationships by allowing us to share experiences, perspectives, and values. All it starts with is listening. With active listening, we can create a more inclusive and tight-knit community where people with diverse backgrounds can form connections based on mutual understanding, empathy, and shared humanity. Now, breaking down barriers in personal relationships not only enriches our lives, but also contributes to the fabric of a more interconnected world. Breaking down language barriers is a collective effort. We can achieve this through community collaboration, online translation tools, diversity training in the workforce, and most of all, active listening. By doing this, we can work towards dismantling these barriers. Everyone, no matter what language they speak, deserves a reality where healthcare is readily available to them, to heal them, not to harm them. It's what everyone's reality deserves to be. Now, tackling language barriers may seem insurmountable, but with a collective effort, understanding, and the will to change, we can bridge the gap that divides us. Now, in my own life, having that effort and putting in that will allowed me to fully communicate with my family back in Punjab, and the effects were profound. What were feelings of disconnection and isolation turned into stronger, blossoming relationships with the ones that I love most. Breaking down language barriers is not just about communication. It's about building connections and fostering a world in which everyone's voices are heard, regardless of what language they speak. Thank you.